significant opening. Just to be able to showcase this One Health collaboration that we have done over the years, we have here in our midst the director of AU Panvar and acting director of AU Panvar, Dr. Nick Mwangpa, who is a veterinarian and holds a PhD in veterinary microbiology from the University of Nigeria, Nsukka. He has more than 26 years of working experience in animal disease control at the national and international level. He was the head of Mycoplasma Research Laboratory at the National Veterinary Research Institute, and he will be immediately following the very important speech and opening by Dr. Ahmed, who will hand over to Dr. Nick to really give us his opening remarks to set this conference open. With your permission, Dr. Ahmed, I hand over the floor to Dr. Nick. Thanks.
No, keep the video.
That's the host. Is the host that?
Good morning, all.
Good.
The Deputy Director, Africa CDC, Dr. Mohamed Akwel, Global Technical Partners, OIE, FAO, and WHO, Regional Technical Partners.
The opening session was taking about half an hour, isn't it?
Participants from various global alliances and networks, participants from AU member states, other African Union sister organizations, participants from regional economic communities, participants from Africa CDC regional collaborating centers. Ladies and gentlemen, all protocols observed. I bring you warm greetings from Her Excellency, the Commissioner of Agriculture, Rural Development, Blue Economy and Sustainable Environment, Ambassador Josefa Sako. I'm indeed greatly honored to be with you today and to deliver these opening remarks during the Africa CDC One Health Conference inaugural meeting, seeking to further enhance the operationalization and consolidation of One Health in the continent. Considering that Africa stands to gain significantly from embracing One Health, as it bears a large burden and risk of both endemic and emerging zoonoses, this conference is timely, and I thank Africa CDC for organizing this conference. Dear participants, ladies and gentlemen, the figures I'm going to refer to may be familiar to you, but allow me to make reference to them in order to demonstrate the significance of animal health to human well-being and public health. Over 75% of emerging and re-emerging diseases from humans come from animals. About 60% of human infectious diseases have an animal origin. Zoonoses are responsible for 2.5 billion cases of human illness and 2.7 million human deaths worldwide each year. Africa bears a large burden of endemic and emerging zoonoses, and key among them include zoonotic tuberculosis, brucellosis, cystic sarcosis, echinococosis, rabies, Congo-Crimean hemorrhagic fever, Ebola, Lassa, Marburg, and sorry, my battery is running low. Please do it.
You need to train people.
Called COVID-19 among others. These diseases, ladies and gentlemen, have high socio-economic impact in our continent, with the endemic zoonosis impacting heavily on the rural and peri-urban poor populations. The endemic zoonosis are difficult to eradicate in the African continent. that is the One Health. Indeed, the increase in complexity of animal production and the associated value chains has led to changes in food systems, which carry new challenges for zoonotic diseases impact and the cost of surveillance, control, and prevention. Direct losses to animal and public health sectors connected mainly to value losses due to morbidity and mortality in humans and animals, and indirect losses such as economic cost caused by the reaction of diseases and the limiting of negative effects all contribute to an unfavorable impact. Morbidity and mortality of animals due to zoonotic diseases also carry other losses related to the wider social, cultural, and economic values of animals and their health and welfare to people. However, ladies and gentlemen, the challenge we face today is that most of the health systems in Africa are not adequately prepared to prevent, control, and prepare for both the endemic and emerging zoonoses. Speaking of animal sector, results from OIE Performance Veterinary Services, PVS, and the joint external evaluations for most of the veterinary services in the continent reflect underinvestment in critical areas necessary to operate optimally in the One Health space. Animal health systems in most countries are weak, and this is reflected by low capacities to prevent, control, and prepare for transboundary animal diseases, including zoonosis. The animal health systems are also not adequately prepared to address other health concerns, such as food safety and emergence of antimicrobial resistance. There is therefore an urgent need for all actors and stakeholders in animal health systems to make the necessary investments and changes to be able to respond to demands for working collaboratively to address the health challenges at the human-animal environment interface. Ladies and gentlemen, recognizing the role of One Health in sustainable animal resources development, and indeed the protection of both animal and public health, the African Union Commission institutions of AU-IBA and AU-Panvar have in recent past been working with member states, the RECs, and partners to strengthen One Health on the continent. Key interventions have included: one, support for cross-sectoral collaboration among animal, human, and wildlife health workers sectors, development and implementation of integrated national action plans against highly pathogenic avian influenza, development of integrated regional coordination mechanisms for the prevention and control of transboundary animal diseases and zoonosis in Africa, convening of stakeholders in One Health to share experience and lessons learned in the implementation of the animal health, provision of quality control services for vaccines to ensure effectiveness of animal vaccines used to manage transboundary animal diseases, including zoonosis, and to curtail emergence of antimicrobial resistance, development of animal health strategy for Africa, and African Union antibiotic resistance framework, amongst others. It looks like a whole list. Participants, ladies and gentlemen, many challenges still remain to be addressed in order to operationalize One Health in Africa. And therefore, this conference is a step in the right direction. This conference will provide us with the opportunity to discuss and agree on practical recommendations and actions to take the operationalization in Africa to the next level. As you may be aware, AU-IBA is a specialized technical institution of the African Union Commission that support and coordinate the development and utilization of the animal resources in the continent, while AU-Panvar is responsible for ensuring the quality of veterinary vaccines produced in Africa. These two AUC institutions remain committed to working with technical and development partners to strengthen veterinary services in Africa and to provide them with veterinary vaccines, quality control services to allow them deliver on their One Health mandate for better human, animal, and environmental health. With these remarks, ladies and gentlemen, I take this opportunity to once again thank Africa CDC for organizing this conference and you participants for accepting the invitations to be part of this conference. I wish you a very successful conference and I thank you very much for your attention. Thank you very much.
Thank you, Dr. Nick, for the really excellent remark on behalf of AU Panvar and AU IBA, one of the most important in-house partners of Africa CDC when it comes to the area of responding to the pandemic, the COVID-19 SARS-CoV-2 pandemic that we are currently working together. Dr. Nick said morbidity and mortality of animal leads to suffering in both animal and human population. There is underinvestment in the One Health space, as shown by the result of the JEE conducted in the animal health sector. The animal health system are not prepared in food safety and AMR, leading to challenges. And very importantly, AU PAMVAC and AU IBA have some strategies they've been working on, including support multi-sectoral collaboration, develop an integration of action plan against highly pathogenic avian influenza, control of transboundary animal diseases, animal health strategy for Africa, and many other strategies that he clearly outlined that these very important institutions of the African Union are really using to improve the practice of One Health on the continent, both for animal and human safety. So he concluded by saying this conference, this inaugural One Health conference of Africa CDC is a step in the right direction. We really thank you, Dr. Nick and Dr. Ahmed, for really setting the pace for this our inaugural One Health conference. And we will now immediately go into the first technical session, which is Africa CDC One Health update. So to do that, I would like to really introduce my colleagues, Dr. Yewande Alimi, the One Health and AMR Program Coordinator, and Dr. Stephanie, who is the Technical Advisor to Africa CDC, will now be sharing more information about the One Health work at Africa CDC, including what Dr. Ahmed just spoke about, the overview of the development and implementation of the Africa CDC's One Health framework for the strengthening of that critical component of what we're doing within the National Public Health Institute and, of course, for some, the Ministry of Health. Let me say, strengthening National Public Health Institute for institutional memory is one of the key components of the new public health order that Africa CDC has been talking about, to be able to, whatever intervention people bring comes under a very strong public health institute for the member state that will outlive the period of the project and serve as a memory where these things can be, the collective improvement can be warehoused somewhere, and the country will continue to benefit even after the lifespan of any intervention. Dr. Wande, let me hand over to you to lead us in that discussion, and you can bring in Dr. Steph as need be. Over to you, Dr. Wande and Dr. Steph.
Thank you very much, Dr. Mohamed, for the nice introduction. Good morning, good afternoon, colleagues, depending on where you are joining us from. I will be sharing with you some of our work as Africa CDC in terms of what we've been doing in the One Health space. Next slide, please. So just a bit of a background for colleagues who might know Africa CDC based on the work that we have been doing on COVID-19 and supporting the response across the continent. Africa CDC indeed is a technical institution of the African Union. And one of the strategic things that we do at Africa CDC is leveraging on this political mandate given to us by the African Union. Our focus is really to safeguard Africa by protecting and building the capacity of public health institutes. We endorse One Health, and as such, through the work that we are doing is fully reflected in how we implement programs across our member states. Just to give you a bit of understanding, Africa CDC has 5 technical divisions, and our One Health program really reflects how truly multi-sectorial it is, because all of our work, we have skilled experts sitting in all of these technical divisions as highlighted, the division that looks at surveillance and disease intelligence, looking at preparedness and response, lab systems and networks, disease prevention and control, and lastly, public health research and institutes. We also have regional collaborating centers who are the closest body working with our member states. We have 5 of them seated for West Africa. Our regional office is seated in Nigeria. For Central Africa, it's seated in Gabon. And for Southern Africa, it sits in Lusaka, Zambia. When we move up to East Africa, our RCC sits in Kenya. And at the moment, we have a North Africa hub, which is currently we're working towards the operationalization. One unique thing in terms of our strategy is we also have representatives of our One Health program seated in each of these RCCs so that we get a closer encounter and provide closer support to our member states. Next slide, please. Why our work is very important is one of the things that we have been championing in the new public health order is that we envision that every member state has a fully functional national public health institute. And we have a few of our core functions for National Public Health Institute, which are highlighted in the slide above. The core functions should be around surveillance and disease intelligence, laboratory systems and networks, information systems, a focus on workforce development, as well as public health research. And finally, every functional MPHI should be able to take on emergency preparedness and response. You might wonder, indeed, the vision of the new public health order is to have mini CDCs, which are the National Public Health Institutes. As such, this has led to the development of the One Health framework that we will be talking about in the next few slides. Next slide, please. So many questions that we, as we continue to carry on this work is, but why are we focused on zoonoses? You've heard our distinguished directors, both coming from Africa CDC, as well as AU Panvar and AU IBA. There is a growing mortality and morbidity on our continent. This is a visual representation of zoonotic disease outbreaks that we have recorded since over the past few years. I think most of them go way back and documented from the past few years, looking at recent zoonotic disease outbreaks in Africa. Therefore, you agree with me that there's an existing burden that must be handled carefully. We consider this carefully as one of the easiest points for us to advocate for a multi-sectorial One Health collaboration, as this is an easy entry point for National Public Health Institutes. Many of our speakers have already both of our speakers have already alluded to some of the existing One Health initiatives across Africa CDC, as well as AU technical organizations, which focus currently on antimicrobial resistance, event-based surveillance, biosafety, biosecurity, and food safety. Some of my colleagues will be speaking about this tomorrow, so please make sure to join some of those sessions so you have a good understanding of the work that we do beyond zoonoses. But most importantly, we consider this framework as a starting point for a wider, broader African Union framework for zoonotic diseases. Next slide, please. So just to give you how this process came about, our work on One Health officially commenced in this context at about February 2019, where we put together a group of One Health experts from Africa CDC, as well as a few of our technical partners to give some support as we started the drafting process. I think about since July 2019 till about October, we went through several validation processes with our member states, getting feedback and review from member states as well as our technical partners. In October 2020, we were pleased to launch the framework. Although we would have wanted to bring everyone together in a place, but you would remember that 2020 was quite a very critical year for us in terms of how the pandemic unfolded across our continent and globally. But we realized that we cannot pause. We must truly understand what the challenges are in our member states. And as a result, we launched a baseline assessment, which my colleague, Dr. Seiler, will be talking about. And since 2021, we have started implementing activities across our member states and across our regional economic communities. Next slide, please. So just this is just a quick summary of what this framework really stands for. It is indeed a technical guidance for national public health institutes as well as ministries of health. It provides them with minimal objectives, defined measurable activities, and a focused guidance, pulling in several operational tools that you'll be hearing about from various technical partners we have been working with, such that member states can fully address priority zoonotic diseases using a One Health approach. Just to understand what the needs were in our member states, our team put together a baseline needs assessment, and my colleague, Dr. Stephanie, will be talking about it over the next few slides. Over to you, Stephanie.
Thanks so much, everyone. Thanks for having us talk with you all today about this work. So as Wandi mentioned, we launched an online survey last year to gain a better understanding of the current level of One Health implementation across the African Union member states, and to inform Africa CDC's One Health program planning activities for 2021. The survey focused on NPHIs and member state capacity for assessing capacity for One Health coordination mechanisms, including policies and plans. You can see that we shared this survey across all of our Africa CDC member state focal points and through existing One Health networks in Africa. The survey period was between the 26th of October, so about a year ago, up until the 12th of February. 59 people responded with representations from 29 member states across all 5 AU regions, which you can tell by the map that's displayed on the right of the screen. The Western and the Eastern regions had the most representation across the continent. As we initially focused on representations from national public health institutes and ministries of health, we were not surprised to see that over 60% of the respondents were from this sector. However, it was great to see that there were representation from the animal health and the environmental health sectors, as well as from research and academic related sectors. When assessing the One Health coordination in place, we saw that over 80% of the member states that responded stated having a multi-sectoral One Health coordination mechanism in place for coordinating and collaboration of relevant activities. For the 25 member states that had multi-sectoral coordination mechanisms in place, You can see that the majority of these actually had the participation of national public health institutes and ministries of health. For most, there are still many opportunities to further strengthen these mechanisms, as you can see by the chart on the screen. Very few currently have decision-making authority, legal or policy frameworks, research, strategic, or implementation plans in place. With regard to priority zoonotic disease surveillance and data sharing capacity, we asked if member states had either indicator-based or event-based surveillance in place for at least 5 of the priority zoonotic diseases, including rabies and zoonotic influenza. You can see that more than 50% of MPHIs and ministries of health surveyed have or are planning to have zoonotic disease surveillance in place for at least one priority zoonotic disease. And if you look to the top right pie chart, you can see that in addition, many of these systems are also coordinating with other sectors. However, there's still many opportunities to strengthen these existing surveillance systems, especially with regard to instituting data sharing policies. Only 20% of those surveyed stated having a data sharing and policy in place. For diagnostic capacity and laboratory data sharing for priority zoonotic diseases, we can see that just over 50% of MPHIs and ministries of health surveyed have diagnostics in place for at least one priority zoonotic disease. However, again, the pie chart on the top right shows that there is a clear need to strengthen the laboratory data sharing mechanisms between these sectors. With regard to One Health emergency response and preparedness capacity, we asked the participants a number of questions. The first one was with regard to having completed a joint risk assessment in collaboration with other relevant sectors. We also asked about operationalized joint preparedness plans. If the EOC of the national level is operational and if it does include staff from other sectors within the public health, animal health, and environmental health sectors. Further, we asked if their EOC did actually go out on investigations, and we set a value or threshold of 80% of those sectors having completed joint or coordinated response for zoonotic diseases. And then lastly, we asked whether or not the sector had an emergency stockpile in place for the priority zoonotic disease outbreaks. And you can see by the screen that while over 50% of sectors have an operational joint preparedness plan in place, the vast majority, especially with regard to One Health staff and joint investigations, still needs a lot more capacity building and focus. Lastly, we asked the respondents about One Health workforce capacity. And the 2 questions that we focused on for the National Public Health Institutes was if that sector had a comprehensive operational workforce development strategy or plan that was in place that addressed priority zoonotic diseases. And you can see that only 24% of those that responded actually had a coordinated or One Health workforce plan in place. The second question also asked about field epidemiology training programs or something of that equivalent. And if those programs included curriculum or different content that addressed priority zoonotic diseases. And you can see that about 34% of those included that, but the vast majority either did not know or did not include that information. So definitely a lot more capacity that could be built on strengthening the workforce components. So in conclusion, all of the components that we talked about with regard to One Health coordination, data sharing policies, coordinated surveillance, diagnostic capacities and laboratory networks, as well as coordinated response and workforce capacity. While there is a fair amount of established capacity across the member states we surveyed, we saw that a lot of the mechanisms that were in place could be strengthened, especially with regard to strengthening across sectors. So Wandi, I'll turn it back over to you to share a little bit more about what we've been doing over the past year. Thanks so much.
Thank you very much, Stephanie. So you would understand that our hands have been quite busy, and we thought it would be important to showcase some of the activities that we have been doing over the last year. And also for member states to take this opportunity to know that we have technical support available to them, which our technical partners will also be talking about over the next few days. I think there's a session later today, as well as day 3. Next slide, please. So COVID has really been an eye-opener for us. And one of the things that we started to do last year, from June to October, was lead this advocacy process of involving not just human health, but also looking at the ministries of agriculture, as well as the veterinary sector and environmental and wildlife sector. So last year we had a 5-part One Health COVID-19 webinar series, whereby we were able to showcase unique approaches that some of our member states have started to pull together to address COVID-19. One of them, a speaker from South Africa, will be sharing some of the best practices that have come out of South Africa. I encourage you to make sure you join that session. Dr. Nick and Dr. Ahmed have spoken a bit about what AU Panvar is doing. I think in the coming 2 speakers after me will be sharing the work that AU Panvar has been doing. Next slide, please. So yes, just to showcase some of the other activities that we have been up to is around the technical support to our member states, as well as the RECs and partners. We're really proud of what our regional economic communities have been working on in terms of advocating for One Health, strengthening One Health, and a few of our REC representatives will be speaking later today to showcase some of the regional strategies to strengthen One Health capacity in our member states. Our technical partners will have been working on joint risk assessment. We, as Africa CDC, have been working with several of our technical partners, including the tripartite, working on joint risk assessment, multi-sectorial coordination mechanism workshops, surveillance, strengthening surveillance and information systems, and of course, zoonotic disease prioritization. I encourage you to stay on to the later part of today's session. You will be hearing our operational tools coming out from our technical partners, and of course, it's important for member states to be aware of this so that they know the opportunities available to them to strengthen One Health. Next slide, please. So one of the other unique things that we thought to do as a team is to develop a continental database of One Health experts, not just from member states, but also regional economic communities. Beyond regional economic communities, we envisage that this One Health database will across academia and research, such that we are able to have a solid database of One Health experts across our continent. I think this is particularly important as we continue to strive for workforce development and improving the capacity of our member states. We recognize how unique it is and our role as the Africa Union to continue to lead One Health coordination. Earlier this year, we had several regional coordination meetings with our technical partners, with AU technical agencies. On day 3, some of our development partners, as well as technical partners, will be sharing some of the investment and funding opportunities available on a roundtable session. I urge you all to also take opportunity to participate in this session. Next slide, please. So how do we tie this all together? As the Africa Union, we recognize how unique we are, not just being technical organization, but being technical organizations with a political mandate. As such, we envision that Africa CDC, in collaboration with other technical agencies, such as AU-IBA and AU Panvar, will lead the process of advancing One Health in Africa. We recognize that we have the ability to convene and lead coordination. We can also advocate for better collaboration and effective communication. So one of the things that we see that this is going to grow to come 2022 is a broader, wider, more holistic African Union framework for zoonosis, which will cover not just public health institutes, but will be applicable to ministries of agriculture, veterinary public health institutes, with the leadership of the African Union technical agencies, AU-IBA and AU-Panvar. As such, we can also work together with our division of environment and technical agencies that work on climate change and environment to work together to advance One Health in Africa. Next slide, please. So on that note, I say thank you very much to all of the participants who have joined us today. Over the next few days, you will be hearing great work that has come out of our continent. This conference is particularly important because it gives an opportunity for us to showcase, to put a spotlight on our continent, to put a spotlight on Africa, such that we are able to showcase some of the remarkable research that many scientists on the continent have been working on, and how other member states from across the world can learn some best practices from us. So on that note, I would like, on behalf of our team, I would like to say thank you very much for joining. And Dr. Mohamed, I hand over to you. Thank you so much.
Obrigado to you, Wande, for another excellent presentation. Merci beaucoup to you, Steph, for that filling in and supporting the presentation from Africa CDC aspects of the One Health really excellent work around the clock, and the One Health team coordinated by Dr. Wande Alimi has really been working around the clock to ensure that this conference come. We are now in it, and not only that, the excellent work you've been doing, driving and coordinating this work together with our implementing partner and together with our sister technical institution like AU-Panvar and AU-IBA is really commendable. So in that spirit, I'm moving that forward. We want to take an update also from AU-IBA, and to do this, we have Dr. Hiver from AU-IBA, who is a senior animal health officer in charge of animal health policy, strategy, and program development and implementation, as well as One Health approach and animal welfare. So it gives me great honor to welcome Dr. Hyvie to give us an update on what AU-IBA has been doing. Over to you, Dr. Hyvie.
Thank you very much, Dr. Mohamed, and good morning to all. Good morning and good afternoon to all the colleagues. It's like yes, to colleague attending this the first inaugural One Health conference. So I will just begin giving an update on AU-IBA activity on One Health. To say that what is guiding AU-IBA work on One Health, it is the animal strategy for Africa, which was developed and also this year by the head of state to provide guidance for One Health stakeholders on strategic approach for the effective implementation of One Health initiative, as well as promoting implementation of One Health based on international guidelines, such as the tripartite guide, among others. And the vision of the strategies and healthy and productive animal population that enhance the economic development and social welfare of Africa. If the mission is to deliver an innovative, harmonized and sustainable animal health system for Africa that meets global standards. Because today it's about how to build strengthening the animal health system in Africa. The goal is to contribute to improve animal and public health, food safety, food and nutrition security, improve livelihood, protection of the environment, and sustainable growth of Africa. And what is there are 6 strategic objectives. I will just focus on the strategic objective number 3, that's strengthening animal health intervention to address current and emerging issues with public health concern at the human, animal, and environment interface, meaning that addressing the One Health, the One Health approach, which is the theme of the conference today. What is now the intervention area of AU-IBA? These are our intervention area, the strengthening the veterinary governance and animal health system, prevention, control, and emergency response to transboundary animal disease and zoonosis, and strengthening the veterinary public health and One Health approach, and compliance, enhancing compliance with animal health and welfare standard, that is addressing the issue of third zoonosis through the development and implementation of a specific program and project, and supporting member state and RECs to enhance their capacity in the management of third and zoonosis. Sorry. It's like my, yes, just care to just give a brief status on this zoonotic disease status in Africa. As mentioned by the director of AU-IBA, Africa bears with heavy burden of transboundary animal diseases and zoonosis. And from what is known, this is from the report, the monthly disease report submitted by member states, 12 out of the 15 third and zoonosis known occurred in Africa. And many of them are endemic zoonotic diseases, namely rabies, anthrax, TB, brucellosis, cysticercosis, echinocosis, and today with the re-emerging public threat, hemorrhagic fever, avian influenza, swine flu, MERS-CoV, and today the SARS-CoV-2, commonly called COVID. And what is guiding our intervention in One Health? We do recognize that there is an interconnectedness of the health of human, animal, and ecosystem. And there are also multiplicity of players needed to address the risk at this interface. And within the environment of inadequate, lack of political will, policies, strategy, program, legislation, and regulation. And also note that there is inadequate of lack of resources. These are led to the need for coordinated, collaborative, multidisciplinary, and cross-sectoral approach to address potential or existing risk that originate at the animal-human ecosystem interface. What is the guiding, our guiding principle? Rely on the global framework developed by OIE, FAO, and WHO. So from the foregoing, good governance for One Health at global, regional, and national level become critical to collaboratively and synergistically address the issue in a in a sustainable manner, as provided by One Health approach, meaning that collaboration leading to the identification of critical constraints and viable intervention to inform policy different from framework for sustainability. What is now AU-IBA key activities on One Health? Just to mention that AU-IBA has a long-standing experience in promoting One Health agenda across the continent, and these key achievements include support to countries to promote cross-sectional collaboration among animal, human, and wildlife health institutions at national level through the avian influenza program. We supported also the implementation of the integrated national action plan against avian influenza, the risk communication in emergency disease situation, the establishment of One Health platform for Africa, as well as the establishment of One Health University network for Africa, especially in East Africa. We have also conducted a stock taking of regional coordination and cross-sectional collaboration capacities across all the 8 REC, recognize AU 8 RECs for the establishment of what we call the integrated regional coordination mechanism. Development of the implementation plan in some RECs. We have also developed and uploaded in our website the TAD and Zoonosis compendium, initiated the development of a training module with the participation of leading universities and One Health program, namely build capacity of member state and RECs and wildlife disease surveillance, support establishment of national and regional One Health platform, and also lead the development of a strategic framework for progressive control of neglected animal diseases and zoonosis in Africa. My colleague Alimi has talked about it, because we are working closely with Africa CDC to develop together and implement the EU framework for IMR control. And currently we are assisting some member states to conduct some situational analysis in their respective countries. And Somalia is one of the examples. In 2018, AU-IBA conducted a Continental meeting on One Health. This is to institutionalize and expand application of One Health in the continent. And the objective of this workshop was to take stock on One Health initiatives and agree on strategy and best practices and identify broad team for pilot activities to broaden and deepen the institutionalization of the One Health strategy in the management of TAD and zoonosis. This is on some pilot country will benefit from AU-IBA support to pilot some activities. Among others, there is a workforce development in member state and RECs in disease surveillance, control, and diagnosis, provided technical assistance to member state on need basis for disease outbreak investigation using One Health approach, capacity building on GMP, good emergency management practices in close partnership with FAO, ECTAD, development of these disease prioritization tools, and conducting disease prioritization on most of the RECs and member states. We have supported also the national and regional laboratories in the management of high consequence pathogen such as rabies, Rift Valley fever, Brucellosis, avian influenza, among others. And AU-IBA, on top of strengthening animal health information system, is on top of strengthening animal health information system through monthly collection, analysis, dissemination of sanitary data among member states through ARIS. ARIS is the Animal Resource Information System that has been rolled out today and domesticated in over 48 countries. There is the establishment of an operationalization of joint rapid response team in member states, risk-based surveillance training in member states and REX, management of health aspects at national and regional laboratory facilities and diagnosis laboratories like CPL Kenya, NADEC in Ethiopia, Israel in Senegal, Lanavet in Garoua, and also supporting, assisting some member states to establish the zoonotic disease units. So in conclusion, Chair, to finish is that's the animal health strategy developed to really implement animal health related issues across the continent, including the management of zoonotic disease and the development of, now we are embarking the development of a comprehensive strategy and action for the elimination, for the control and elimination of rabies, and surveillance of strengthening the veterinary public health and One Health in member states and REX. I've already mentioned that. And development of a continental strategy on One Health that you, Deputy Director, talked about, and resource mobilization to implement One Health related activities. And it is expected that the effective implementation of One Health approach will lead the development of a continental One Health strategy and action plan with the ultimate of improving capacity to anticipate and mitigate the negative impact of animal diseases, public health, food safety, food and nutrition security, and sustainable economic growth. To finish, to conclude, is to say that One Health has generated much appeal in the continent, but there are many challenges facing its operationalization, institutionalization, and long-term sustainability. One Health approach is an important tool in the fight for major zoonosis and emerging and re-emerging disease with high public consequence, policy and operational bottleneck, knowledge gap, inertia of the silo culture, scarcity of resources, technical capacity, gatekeeping by One Health champion limits the operationalization of One Health. Although much is happening on One Health across Africa, the level of the operationalization institutionalization is low, and one must recognize that the progress is low. The national is probably the most important node for the operationalization, institutionalization of One Health approach. But indications are that it's also the least developed currently. I thank you very much, Chair, and over to you.
And another excellent presentation from Dr. Haver from AU IBA. Thank you so much for these updates of activities going on at the AU IBA, and a very important component of the African Union overall policy for animal and human health security. Now let's go to the next, which will be the last for this session before we hand over to the session that will be moderated by Dr. Wessam. For this, we are going to take updates from the AU Panvar. And to do that, we have Ms. Ethel Tsongo, a laboratory scientist with a career spanning over 25 years. Ms. Tsongo will be presenting the AU Panvar One Health update. Ms. Tsongo is quality focused and trained in quality management for ISO 9001 9001 certification and accreditation. She's also certified in biorisk management and shipping of infectious substances. I know that recently Africa CDC and AU Panvar has had to ship some specimens around to ensure that we're able to do pathogen genomics sequencing. Thank you, and let me hand over to Ms. Itel to take us through the updates for AU Panvar. Over to you, Ms.
Good day to you all. Today,
you're on.
Okay, thank you.
You're on. Please go on. Yeah.
Yeah, I'm just putting my screen for share. So I'm going to talk on AU Panvar's One Health updates. Just putting my screen to full screen now. So first, I would want to show you the outline. Can you hear me? Hello?
Very clearly. Please continue.
Oh,
You're
okay.
loud and clear.
Thank you.
Excellent. Yeah.
I'm going to give you a brief outline. This is the outline of my presentation. As it shows there, I won't go through it, but that's the outline. And I'm going to start by giving a brief presentation of AU Panvar. Can you see my screen?
Yes, madam, you can go.
Yeah,
Oh,
please.
okay,
Your screen is very clear. Yeah.
Thank you. AU Panvar was established due to the poor quality of vaccines, which were actually being produced in most of the African countries. And this was found to be the cause for the persistence of rinderpest for over 70 years in Africa. And the study that was done by FAO established that the quality of the vaccines was not good. And then with AU Panvar coming in, the quality of the vaccines was improved significantly, and rinderpest was, and the African continent was basically able to eliminate the rinderpest. And it was also confirmed that it was due to the quality of vaccines that the rinderpest was eliminated. And due to this success of the rinderpest campaign, AU Panvar was then institutionalized as the organ of the African Union in 2004. AU Panvar's mission is to promote the use of good quality vaccines and diagnostic reagents for the control and eradication of animal diseases in Africa. It was given 5 major mandates, but of those major mandates, we have vaccine quality control of all veterinary vaccines imported and all produced and imported into Africa, and also production of essential biological reagents for animal disease surveillance and control. And added to this, now after the inception, we had other specific mandates which were added, and one of the major ones is maintaining Africa free from rinderpest. So AU Panvar was identified as one of the centers for the sequestration of rinderpest material. There are 5 in the world. And also just to be able to respond quickly to any outbreak that may occur. Also, AU Panvar hosts the Continental Vaccine Bank. And this vaccine bank was started mainly for rinderpest, but is meant to expand to other diseases. The other mandate is also harmonization of vaccine registration, because what we found was in Africa, a lot of labs were producing vaccines, but they were not at the standard where they could actually be able to be registered. And even in the same African countries they were produced, they were also not being registered. So AU Panvar is at the forefront of harmonization of the vaccine registration. AU Panvar also collaborates with partners in animal disease control, in vaccine technology transfer, and in many areas of vaccine production, and also in reagent production. In 2013, AU Panvar became the collaborating center for the OIE in vaccine quality control. It also became a reference center for vaccine quality control and technologies in 2015. It was designated as the FAO OIE Rinderpest holding facility in May 2015. And with all this, it meant AU had to really bring its quality, AU Panvar had to bring its quality up in terms of its activities. So it was certified as in 2017 for ISO 9001 quality management system. And also for PPR vaccine quality control, it was accredited for ISO 17025 for four major tests that are conducted for the PPR vaccine. And these are basically the certificate of accreditation and certifying for the ISO 9001. Impact of animal disease on public health. Due to the nature of the interaction between humans and animals, it's like they are inseparable. Humans, we get our food from animals, we keep our animals. It has been identified that about 60% of human pathogens are actually zoonotic, and that's from the OIE, that's reference from OIE terrestrial code. And also 75% of all emerging infectious diseases in humans are actually of animal origin. So what is AU Panvar doing to support the One Health initiative? So the major concern is with zoonotic diseases. The One Health concept is expected to be able to be a pillar in mitigating against all zoonotic diseases. The major zoonotic diseases in Africa, which are controlled at AU, which have vaccines and that are controlled at AU Panvar, anthrax, brucellosis, rabies, and Rift Valley fever. And zoonotic diseases can definitely be controlled through vaccination. In terms of antimicrobial resistance, AU Panvar is part of the African Union Antimicrobial Resistance Joint Task Force. And AU Panvar has participated in the framework rewriting and also the validation workshops for the Antimicrobial Resistance Joint Task Force. Vaccines certified by AU Panvar help to prevent bacterial diseases. And this basically, we're talking of bacterial diseases, and we have a lot of bacterial diseases that are actually controlled by vaccines. And in that effect, it actually reduces the use of antimicrobials in the livestock, thereby reducing the incidence of antimicrobial resistance. On the 2nd of May 2020, AU Panvar was designated as a COVID diagnostic laboratory. And this came by because when the COVID scourge came in, AU Panvar was already well equipped in terms of the laboratories and the personnel to be able to take up this task. And it was officially inaugurated, it was officially launched on the 2nd of May by the Commissioners of Rural Economy, of Agriculture, and the Commissioner of Social Affairs. And this also is actually expected in terms of the OIE guidelines, in terms of the laboratory support for the COVID-19 control. OIE gave guidelines which veterinary laboratories are to follow, and AU Panvar falls under the veterinary laboratories. And these guidelines come in, are there to support quality control, biosafety and biosecurity, and also high throughput testing for the surveillance and control of infectious diseases, of which COVID-19 is one. And also veterinary services to provide expertise in the fields of epidemiology, risk assessment, training, and risk communication, of which AU Panvar is also doing those. Since we are talking of highly infectious diseases, AU Panvar was already equipped to be able to handle them because it works on a biorisk management system, which is guided by the principles from the OIE, the WHO, Food and Agricultural Organization, and also ISO 35011 of 2019. AU Panvar provides service for diagnosis of COVID-19 through the AU Medical Health Services Directorate. So samples for COVID testing are collected in the AU Medical Services Directorate. They are sent to AU Panvar for real-time PCR testing. Results are sent back to AU Medical Services, which then compiles and issues the results within the same day. And since May 2020 to October this year, 2021, more than 28,000 samples have been tested. AU Panvar is also supporting the genotype characterization of the SARS-CoV-2 virus through providing the relevant samples for including in the test. Still to continue with the support to the COVID-19, AU Panvar is working in collaboration with Africa CDC in development of serology test. The reagent production laboratory for AU Panvar is well developed, has the capacity to actually produce different diagnostic tests, both molecular and serological tests. And currently work is ongoing for development of COVID-19 diagnostic ELISA tests. And also discussions are ongoing for pre-qualification of diagnostic tests so that we can also be able to assess the different diagnostic tests that are produced in terms of their efficacy. AU Panvar is also in collaboration with our host country, Ethiopia, with the Ministry of Technology and Innovation on a project where they are actually testing the effectiveness of one herbal extract on the COVID-19 virus. And with the kind of materials that AU Panvar works with, we deal with a lot of infectious substances and also dangerous biological specimens. So AU Panvar is involved in producing the guidelines for the transport of infectious substances and biological specimens in Africa. And this is working in collaboration with the FAO, AU IBA, and Africa CDC. All technical staff at AU Panvar are actually certified shippers, and 4 of them are certified shipper trainers. So currently we are also providing now training to various institutions where it is required. And in conclusion, by ensuring that vaccines used in the field are of good quality, AU Panvar is helping control the spread of zoonotic diseases and reducing the use of antimicrobials. AU Panvar will continue to work with partners on the One Health initiative and is committed to improving animal health for positive impact on human lives. Thank you very much for listening.
Excellent. Thank you, Ms. Itel, bringing an excellent end to the inaugural session of this conference. The conference was declared open by Dr. Ahmed, where he spoke about high level what Africa CDC has been doing and continue to do to support One Health. Especially he introduced the Africa CDC One Health framework that we are using to support member states and will continue to use to support National Public Health Institution and Ministry of Health in improving the One Health policy. He was quickly followed by the director of AU Panvar and acting director of AU IBA, where he spoke at length at how these two institutions are supporting multi-sectoral collaboration, developing and integration of action plan against highly pathogenic avian influenza and control of transboundary animal diseases. Excellent presentation from Dr. Nick. Then we went on to have an update from what Africa CDC has been doing on ground. This update was taken by Dr. Wande Alimi and Dr. Steph, who really were able to provide us more detail on what we've been doing in the area of One Health, including how we've been, we hope to continue to use that framework to support member states and work very closely with our sister institution, AU Panvar, AU IBA, and other global partners in the area of One Health like WHO and OIE to ensure that animal health on the continent really continue to get the attention it required. We went ahead to get updates from AU IBA, especially in what they are doing, including the excellent work they've been doing supporting countries with veterinary and animal health capacity and capabilities, showcasing how AU continues to support her member state and advocate for One Health on the continent. The excellent work of AU Panvar, as Ms. Etel just finished discussing, really, we must remember the COVID, what AU Panvar, as she rightly said, is doing right now in supporting Africa CDC in the areas of testing for COVID-19. An excellent example of how we can put together all aspects of health to be able to respond as humanity, as everybody, to ensure that we take care of this pandemic. I remember the eradication of rinderpest, ensuring vaccines of good quality are available to member states. These three institutions will continue to lead the One Health activities and support AU member states on the continent, working, of course, with our international partners like the OIE, WHO, and others. This brings an end to this session, but we will immediately go to another very interesting session. This session will be chaired by no other person than the Africa CDC COVID-19 incident manager in the person of Dr. Wessam Mankola. I know Dr. Wessam is online, and we will be looking at the country presentations from the various countries we have here with us. Dr. Wessam, are you on?
Yes, Dr. Muhammad.
Okay, Dr. Wessam, I know your session promised to be an even very interesting session, and I will encourage everybody to key in and listen to excellent presentation from our member state. And like I said, Dr. Wessam has ably been the incident manager of our Emergency Operations Center here in Addis Ababa since the onset of this COVID-19. And I remember we started off really not knowing where we are going, but today we stand very proud to say that Dr. Wessam has done Africa really proud in steering Africa CDC EOC to achieve what it has done. Dr. Wessam, over to you to lead this engagement. I hand over to you. Thank you to everybody, and Dr. Wessam, over to you. Thanks.
Thank you so much, Dr. Muhammad, for this nice introduction. Good morning, good afternoon, good evening, based on where you are. Thank you for joining us for this important conference about the One Health approach in Africa. As you know, One Health approach recognizes that people health closely contact with animal health. And this COVID-19 pandemic as a zoonotic disease came to prove the importance of having this One Health approach. This devastating pandemic in the 21st century, with more than 245 million cases reported worldwide, and with more than 4.9 million deaths, confirm about the importance of having this One Health approach and collaboration between the people working for human health and animal health together. One Health shouldn't be at the fringe of the operational health policy. Rather than it should be at the center of the operational health policy. In the first sessions, we went through the experience from 3 institutions within African Union Commission, Africa CDC, AU IBAR, BAMVAC, and we listened to the approach that each one of these organizations went through the COVID-19 pandemic response and how they collaborate with each other, having the human health component with animal health component in order to respond effectively and efficiently for such zoonotic disease and such pandemic. And in our second session, we'll be happy to listen to the country experience from the continent. We'll be listening to experience from South Africa about how they implement the One Health approach during the response of this COVID-19 pandemic. We're happy to have Dr. Mishik Mulomba with us in this coming session. Dr. Mulomba is the head of animal health and protection at Agriculture Research Council, Undersport Veterinary Institute. He's a member of World Organization for Animal Health Scientific Commission for Animal Disease and the current chairperson of African One Health Network. He holds bachelor degree of veterinary medicine from University of Zambia, also a Master of Science degree from Reading University and Doctor of Philosophy from Prince Leopold Institute of Medicine in Belgium. His background training in epidemiology, tick-borne disease, TADs. He has extensive field and laboratory experience in different disciplines, vaccine production, TADs, especially foot-and-mouth disease, contagious bovine pleuropneumonia, TBDs. He has published extensively on TBDs and TADs. His interest branched of One Health, and he currently serves as co-chair of South Africa One Health Forum and current chairperson of African One Health Network. Kindly join me in welcoming Dr. Mulomba, and let's listen to his experience and how South Africa implemented the One Health approach during the COVID-19 response. I encourage you, if you have any question, kindly write your question in Q&A box. Then after the end of the presentation from Dr. Mulomba, we can go through the question and give him the floor to respond to your question. Thank you, and over to Dr. Mulomba.
Thank you very much, Dr. Mankula, and good day to all the participants. And thank you for that wonderful introduction. So I'm going to talk to you about the One Health approaches that we adopted in South Africa, especially during this COVID pandemic. And from the outset, I should indicate that this presentation is a product of the 3 of us. Therefore, I wish to acknowledge my colleagues, Wen Ramkrishna from the National Department of Health, Zoonotic Diseases, and also Jackie Ware from the National Institute for Communicable Diseases, Special Viral Pathogens Division. Jackie also happens to be my co-chair on the National One Health Forum for South Africa. So I'll just quickly take you through an overview of the case trends of events since we had the first case of the COVID-19 in South Africa. That happened on the 5th of March 2020. And as you might appreciate, it was a new disease. There was a lot of scaremongering about it. People were scared. Government had no experience on how to deal with it. And therefore, within a very short time of 3 weeks, the government imposed the maximum level of alert level 5, which meant that everything stopped. Basically, there was no movement, there were curfews, the schools had to close everything. But during that time, there was a lot of work that was done so that we could find out the capacity that we had in the country to deal with this situation. And indeed, by 30th April, we see that the alert level was moved to level 4, signifying government confidence in their ability to deal with the situation. And then, of course, from that time, the cases started rising, and this was the first wave of the disease. And it only reached its peak on the 13th of July, 2020. And during that time, the schools had closed, and as I had indicated, many restrictions were in place. And then the cases started falling, and by 21st of September, they had fallen sufficiently to give the government confidence to move us back to alert level 1. At that time, the curve was flattened, as you can see from there. But of course, then we were hit by the second wave. Cases started rising on the 3rd of December, and the rise was so spiked that by the 28th of December, we were in crisis mode again, and government had to reimpose alert level 3 so that we could put a lid on the rising number of cases. And that peak, it peaked off on 12th of January this year, and that's when the cases started going down. So that was really the coming down of the second wave. And by the 1st of March this year, the curve had been flattened, as you can see from there. But then came the big one, the Delta variant. And with this one, on the 31st of May, we had the first indication that things were going to be different. So we moved to alert level 2. And by the 28th of June, we were compelled to move to alert level 4 because the cases were just too many, and there were differences with this variant in that the deaths were also much more than in the first two waves. So it picked off at 4th July, but what helped in this instance was that the vaccinations had also started. So some of the key personnel and those groups which were at the highest level of risk, we had started vaccinating them. So come July 26, we had moved down to level 3. And then by October this year, the 1st of October, the cases had dropped sufficiently to a level where we had moved back to level 1. And also I should indicate that the vaccinations did help a lot. And talking about vaccinations, as at 11th October of this year, we had vaccinated about 25.3% of the total adult population, 18 years and above. These were vaccinated with either the single-shot J&J vaccine or the two-dose vaccine of Pfizer. And looking at the country as a whole, the Western Cape has the highest proportion of the adult population that has been vaccinated, standing at just below 30%, with Mpumalanga having the lowest proportion of the adult population vaccinated, standing at just about 21%. Now, talking about the circulating variants, of course, the Delta continues to dominate in all provinces in South Africa. And what we saw was that once the Delta came in, the other lineages which had been detected before, they decreased significantly with the Delta gaining dominance over all this. Luckily, we have not yet detected the Lambda and the Mu variants in the country, although we know in South America that these variants are still there. Now, you would appreciate that at the outset of the first case on 5th March 2020, the National Department of Health or the ministry was short of testing capacity because this was a new disease. And therefore, they set about to get every testing capacity that they could in the country to assist with the testing of the cases. And one of the institutes they approached was mine, which is the Ondersteput Veterinary Institute. We signed a service level agreement with the National Health Laboratory Service. And the test method that we've been using is the Auplex 2019 nCoV assay. This detects the 3 SARS-CoV-2 targets. And then we've also got a kit which is specific for our internal controls for the test. Now, the experience which we had gained in testing human samples was to come in handy later on when we were to start dealing with the animal samples from non-contact with the human cases. So let me just go very briefly on the One Health approach in South Africa. We recognize quite early on that the complexity of the interactions along the interface we face require strong and consistent collaboration among the various sector players, especially in animal health, human health, and also the environment. So the structure that we put in place is called the One Health Forum. And under this One Health Forum, the representation there is from the Ministry of Agriculture, the Ministry of Health, the ministry responsible for the environment, and then the National Institute of Communicable Diseases, then my institute, the Ondersteput Veterinary Institute, as well as all the provinces in South Africa, including some universities. And the goal of this forum really is to strengthen collaboration and coordination between public health, animal health, and environmental sectors with a view to prevent and control zoonotic diseases, as well as assist us to meet the IHR obligations. So how is this forum structured? There is a steering committee, and that steering committee is co-chaired by the National Institute of Communicable Diseases and the Ondersteput Veterinary Institute. The Ministry of Agriculture acts as the secretariat for the forum or the steering committee. And we've been working very hard looking at different zoonotic diseases like rabies, like brucellosis, and trying to coordinate everybody who is involved in this so that we have a seamless implementation of the control strategies for each of these diseases. But I'm very excited to say that South Africa will soon be finalizing a One Health Forum framework that is going to guide the activities of all stakeholders who are involved in the One Health field so that we can all have shared responsibilities and also shared benefits. So let's focus a bit now on the global expert view of the role that animals play in COVID-19 transmission and epidemiology. Of course, you appreciate that this is a disease which jumped from animals to humans. So there was a lot of apprehension in the beginning, and people, even those with their own pets, were suddenly scared of their pets. So as indicated in my introduction, I also belong to the expert group of the OIE on COVID-19. And we did a lot of work, especially in the formative months of that, including coming up with the guidelines, which my colleague from Panvar spoke about in terms of animals and COVID-19. And during that time, we were able to show that a number of animals are susceptible to SARS-CoV-2 infection. However, that being the case, we also demonstrated that very few species, notably only the minks and deer to a certain extent, had been significantly impacted in their natural environment. And apart from that, some of the cases which we had, of course, were coming from the zoo settings, where we had lions, tigers, Asian small-clawed otter, and other animals testing positive there. But as for the main companion animals of dogs and cats, we were able to show that these animals only got infected from their human owners who also had been infected. But in South Africa, we've had two significant human-to-animal transmission events that have occurred, and both of them have been in zoo animals. The first case was in August last year, where a 5-year-old female puma tested positive, and we were able to show that she got that infection from the human subjects in the zoo. And then the second case was in June this year, when first a 14-year-old lion tested positive, and she was later followed by 2 other lions who tested positive. And in both instances, the animals which were close to these animals in the zoo were tested, and they all tested negative. So this really gave us, the understanding that SARS-CoV-2 is potentially not an animal-to-animal transmission disease per se. So in concluding, what are some of the research areas that we are focusing on in South Africa, and which we'll be focusing on in the coming, few months or so? This list is not exhaustive, but we have already looked at one project which is looking at the development of novel plant-derived preventative and therapeutic medicines for COVID-19 in South Africa. And there's also another project which is looking at the medicinal value of plant-based therapeutics. And there was a very important study that was done looking at the impact of COVID-19 on smallholder agricultural systems and how they impact on food security. Then going forward in the pipeline, we are designing and very soon, hopefully, we'll be implementing a study on active cross-sectional and longitudinal surveillance of SARS-CoV-2 in wildlife at the human-wildlife interface. And also we will look at the pathogenesis of SARS-CoV-2 in animal models, because we need to have that confidence that we are doing surveillance at that interface to be able to pick up any of the viruses which we want to jump into humans from wildlife. So having spoken about wildlife and animals, let me conclude by saying, although several animal species have been infected with SARS-CoV-2, these infections are not a driver of the current COVID-19 pandemic. Rather, the pandemic is largely driven by human-to-human transmission and not animals. So really, even in those guidelines which we developed for the OIE, that is the understanding which we portray to say, if you have your dog, if you have your cat, don't throw them away. Those animals are innocent. You are more likely to pass the infection to them rather than them passing the infection to you. So Chair, let me end here and thank you very much for the opportunity.
Thank you so much, Dr. Mulomba, for this nice presentation and the experience from South Africa and how South Africa implemented the One Health approach through having One Health Forum that include NICD, Undersport, Veterinary Institute, and also National Department of Health, and how they work together to address the issue for the COVID-19 pandemic. Colleagues, again, if you have any question for Dr. Mulomba, kindly draft your question within the Q&A chat box. While we're waiting for those questions, I have two questions, Dr. Mulomba. Let me start with the first one. From your experience in South Africa, how did you see the One Health approach help South Africa in responding to COVID-19 pandemic? What is the added value from coordinating the institution focus on the human health and animal health and working together to address COVID-19 pandemic? Over to you.
Thank you very much, Dr. Mankula, for that question. And it's a very, very, important question. I think it's a given that we have been segmented or working in silos, largely before the COVID-19. Yes, there was talk about One Health, but I think this COVID situation has really prodded us to work together much, much closer. And there are a number of diseases. Let me give an example of one of the diseases we looked at, which is brucellosis. Brucellosis is a very important zoonotic disease, but there has rarely been coordination between the human and animal health fields in tackling it. And we realized, from the animal health side, when we went to one province in South Africa, which is the Northern Cape, to say that the brucellosis cases in that area were just too many. And when I went for a field day and we were, sampling some animals, one of, the people whispered to me about the challenges they had in that community. And those challenges were related to the fertility of, people. And this was leading to a lot of marriages breaking up. And then while they were relating this and we were waiting to sample the animals, I could see people drinking directly from the cow's udder, the milk. And then it was quite clear and apparent what situation we were dealing with. And when we got our samples, we came back to the lab. We found that the whole area was chock-a-block with the, brucellosis. And then we passed on this information to our human colleagues. And when they went there, looked at the human population, they also found that indeed this was the case. So that is just a small or one example of how we can work together to resolve, some of these underlying problems which require a One Health approach in order for us to have an impact on the population that we are dealing with. So really this COVID-19 situation, it has given us an impetus which, has prodded us to work more closely together. And my wish is that even if it was to go down, we shouldn't lose that impetus which we have gained now, so that we can continue on that aspect. And I'm very, very happy to see that in many African countries, they are having these coordination mechanisms for One Health. because it's something which needs a deliberate effort. It won't happen by accident, I can assure you. So we need to take these deliberate steps to make sure that this happens, and then it doesn't only happen, but we also maintain it even going forward.
Okay, thank you so much. Mulumba, we have one question in the chat box. This is from Mukadi Monwa. Mentioned great presentation, Dr. Mulumba. And in the two presented scenario from the zoos that you mentioned, did we have any fatalities?
Okay, yeah. Luckily, there were no fatalities. Both the puma and also the lions, they survived. And I think that's something which we should also be aware of. The fact that, you know, these animals do get infected does not mean necessarily that, one, they are going to have very severe infections, and two, that they are going to be able to transmit these infections back to humans. So we are happy to report that in both those situations, all the animals recovered fully.
Okay, another question from Shiduzi Declan. She mentioned, thank you for the presentation. And I was wondering if those animals had symptoms before being tested for SARS-CoV-2. If they did, are they similar to human symptoms?
Yes, definitely there were symptoms in order for, you know, the zookeepers to notice that these animals were not well. And this was largely like the flu-like symptoms, which you also, you know, notice in humans. And in case of the lions, when these symptoms began to be exhibited by the first lion, then the other two lions which were in the same enclosure, it was just, you know, automatic that they also be sampled even before they started showing the symptoms. So yes, they do show some symptoms, even though these symptoms might be mild, but they are also flu-like symptoms which are exhibited by the animals.
Okay, thank you. One last question. If you can tell us in brief about the challenges that you faced while you are implementing this One Health approach in South Africa, and how do you overcome these challenges? Over to you.
Yeah, I think thank you for that question. Really, the challenges are inherent to ourselves. I think you'll find that in most cases, when we are dealing with animal health, the type of regulations we put in place, we do not think outside the box to encompass the other disciplines that we are going to work together with them. This is when it comes to, you know, human health. And for example, I just indicated we had to enter into an SLA, a service level agreement with the National Health Laboratory Service, because we couldn't just start testing human samples, because if you look in the legislation, there are certain things which you need to comply with. So I think, in my opinion, those are some of the things we should start looking at, because it does take time to navigate some of these things to the point where you can start implementation. So going forward, probably we should be more proactive. From an environmental perspective, which are the things or legislations or regulations we can collaborate with human health and animal health? The same thing from a human health perspective and also from an animal health perspective. And I would like to believe that these structures which are being put in place, that should be one of their mandates, to be looking at some of these things so that we are proactive rather than reactive when we are faced with an emergency situation.
Thank you so much, Dr. Mulumba, for bringing your wealth of experience to this session. And thank you for sharing this experience from South Africa. It has been a pleasure to be with you today and to give this presentation for the participant joining us in this One Health conference. Thank you so much.
It was my pleasure. Thank you.
And now let's move from country experience to regional experience. And let me give the floor to Dr. Lul Rick. Dr. Lul is Africa CDC Regional Coordinator for the Regional Collaborating Center for Southern Africa, has lots of experience in public health and emergency management, and he is the one coordinating the response in Southern African region on behalf of Africa CDC. And let me hand over to him to listen for experience from regional perspective and how One Health approach implemented within the Regional Economic Committee. Over to you, Dr. Lee.
Well, good afternoon, and thank you so much, Dr. Wissam, for a very, very excellent introduction, and also for excellent moderation of one of the very, very inspiring from the country's experience. Again, ladies and gentlemen, depending on where you are, good afternoon from Southern Africa regions. Ladies and gentlemen, all protocol observed. First, allow me to thank each and every one of you for joining us today at the very first Africa CDC inaugural One Health Conference in Africa. My name is Dr. Lurik. I'm the regional coordinator for the Southern Africa Regional Collaborating Center based in Lusaka, Zambia. As you are aware, this conference is the first ever One Health conference in our continent. It's intended to create an opportunity to share best practices, experiences from the African Union, from the Africa CDC, also from all the technical agencies under the African unions. We also just finished the very inspiring experience from one of our member states in Southern Africa. And at this point in time, we're going to have also an experience from regional economic communities. We'll start from Western Africa, we'll come through Eastern Africa, and also we'll end at in Southern Africa region. Today, I'm very, very privileged to moderate and also to introduce three amazing panelists from different backgrounds. The first presentation will talk exclusively on One Health data platform from West Africa Health Organization known as WOW, also from East African Community Regional One Health Strategy that also will be presented. We'll end up with the Southern Africa Development Community SADC's on antimicrobial resistance experience. Before we dive deep into the panel introductions, I want to remind you that this session has been allocated only 30 minutes from very best experts in our continent, bringing the regional economic community work that they are doing. As we all will always remind that alone we can do so little, but together we can do so much. Therefore, leaving any organization behind, member states, or any regional economic community behind is not an option. Working together will give us more opportunity, more magnitude, and we can be able to accomplish big things, good things for our health. To kick off these conversations, allow me to briefly introduce our first panelist. Dr. Brigitte Locoso has served as a development professional in different capacities over the last 20 years, working with the government agencies, also work with the community-based organizations, international and non-governmental organizations, and intergovernmental organization as well. He's currently heading the Health Emergency Preparedness and also Response Division within ECOWASA Regional Center for the Surveillance and Controls, and has responsibility of strengthening emergency response, supporting national public health institutions, and also the Minister of Health across West Africa member states. He is also One Health focal person for economic community of the West Africa states. Prior to joining WOW, Dr. Locoso served as a health program team lead for Population Services International and for Africa on USAID-funded interventions in Benin republics. At this point in time, ladies and gentlemen, let me it's my pleasure to introduce Dr. Locoso, who will be presenting on One Health data platform. Dr. Locoso, over to you.
Thank you so much, Chair, for this opportunity. Allow me to share my screen. I don't know if you can see my screen.
Yes, we can see it. Just put it on presentation mode, please. Yes.
Yes, I put it on presentation mode now. Am I good?
Yes, you're good to go.
Okay, excellent. Let me do my presentation. Let me make the Mesdames et Messieurs, merci beaucoup au Président pour cette opportunité qui est offerte à l'Organisation ouest-africaine de la santé pour vous parler de la plateforme régionale Une seule santé de partage de l'information sanitaire. Alors, ma présentation va suivre ce plan de vous donner un aperçu sur l'historique de la plateforme, des objectifs, rappeler les principales étapes de mise en place de la plateforme et les principes, le processus de collecte d'informations et de rapportage des données, mais également comment nous utilisons les données Une seule santé et je vais terminer ma présentation par une synthèse du processus. Alors, quand nous parlons de la plateforme régionale Une seule santé en Afrique de l'Ouest, notamment en matière de partage de l'information sanitaire, c'est vraiment une activité qui fait partie du mandat même de l'OAS en tant qu'organisation régionale en matière de santé. Depuis 2006, environ 15 ans que nous avons commencé, et nous avons été amenés à mettre en place cette plateforme pour pouvoir influencer les politiques et les programmes en matière de santé dans la région. Alors, nous avons commencé en 2009 à mettre en place une phase programmatique pilote, SIGIS appelée, mais elle n'a pas marché parce que nous n'avions pas les outils, nous n'avons pas les protocoles opérationnels normalisés et cela a amené l'OAS et les partenaires en 2010 à pouvoir, sur la base des leçons apprises, développer une nouvelle version de la plateforme. Mais on s'est rendu compte très tôt, sur recommandation des pays, qu'il fallait élaborer une politique régionale pour pouvoir harmoniser les vues. Ce qui a été fait en 2012, et on a commencé par mettre en œuvre la politique lorsque l'épidémie de la maladie à virus Ebola en Afrique de l'Ouest est survenue. Cela a renforcé l'initiative qui était en cours et nous a amené à mettre en place un entrepôt régional des données sur l'information sanitaire. Et cet entrepôt, justement, a évolué. Et quand, en 2016, les ministres de la Santé de l'Afrique de l'Ouest ont adopté l'approche Une seule santé, nous avons été obligés de convertir cette plateforme, qui était essentiellement données humaines au début, à intégrer les données de santé animale et également les données provenant d'autres secteurs à partir de 2017. Et ainsi, nous avons continué à renforcer la plateforme et à l'arrivée de Covid, on a également intégré les informations sanitaires en lien avec le Covid. Alors, quels sont les objectifs de cette plateforme? C'est notamment assurer la disponibilité et le partage de l'information sanitaire sur les maladies à potentiel épidémique et les autres événements majeurs de santé publique dans la région CEDEAO. Alors, je vais maintenant vous faire passer et vous faire revisiter rapidement les 9 étapes de la mise en place de cette plateforme régionale des données. Alors, nous avons commencé, comme je l'avais dit en 2012, par la mise en place de la politique qui a servi de cadre vraiment pour harmoniser la vision et la stratégie. On a vu que toutes nos expériences avant ont échoué parce que nous n'avions pas cette vision collective-là. La deuxième étape a été la phase de développement d'entrepôt. Et ça a été participer libéralement. Ça a été une longue étape de négociation et nous avons travaillé beaucoup avec l'Organisation mondiale de la santé à travers le réseau de la surveillance intégrée des maladies de la réponse pour pouvoir l'information qu'il faut. Il y a une liste d'activités que nous avons entendu pour démarrer la mise en place de cette plateforme régionale de données. Et une étape essentielle a été la création de cette plateforme au niveau régional. Et cela passe nécessairement par la mise en place des indicateurs qui sont à renseigner et leur périodicité également. Et également des indicateurs qui devaient être en lien avec les programmes de COAS même et les intérêts des pays, afin de pouvoir être utiles pour influencer les politiques et les programmes de santé. Une grande étape essentiellement pour pouvoir avancer a été la cartographie, parce qu'on a vu que le découpage au niveau des pays n'était pas les mêmes et il fallait venir à une négociation pour avoir des données comparables et permettre aux différents acteurs de pouvoir avoir des données qui leur permettraient de pouvoir renseigner de façon unique. Et une étape a été le démarrage de la phase de formation, du renforcement de capacités, du partage d'expérience.
The capacities and share information.
Et aussi la phase de la mise en liaison entre et également le site web de l'OAS où les citoyens de la CEDEAO pouvaient avoir accès à l'information sanitaire disponible. Aujourd'hui, nous sommes maintenant à la phase de transfert automatique des données pour éviter que les pays soient obligés toujours de vous envoyer l'information, mais automatiquement, quand les données sont saisies dans le base, que cela soit fait au niveau régional. Et la dernière phase, maintenant, c'est la phase d'amélioration continue qui nous a permis de travailler avec Africa CDC et d'autres organisations régionales pour intégrer de nouvelles réformes et de moderniser notre plateforme régionale. Donc, cette phase aussi est importante et c'est à cette phase que nous sommes essentiellement. Alors, comment intégrons-nous les données? Voilà la plateforme un peu, comment ça se présente dans l'espace CEDEAO et les pays peuvent entrer pour pouvoir entrer les données. Voilà un peu comment ça se visualise sur la plateforme et voilà des formulaires de collecte d'informations pour les pays entre les différentes informations qui existent. Le taux de rapportage, on s'est rendu compte qu'au niveau de la santé humaine, compte tenu du fait que depuis 15 ans, on travaille là-dessus, le taux de rapportage est très élevé et nous travaillons beaucoup avec le système de la surveillance intégrée de la maladie pour avoir un taux de rapportage de plus de 90%. Mais quand on regarde par exemple les données de santé animale, on n'en a pas encore beaucoup. Nous travaillons beaucoup avec notre institution sœur, le Centre régional de santé animale, pour pouvoir vraiment, j'allais dire, avoir les données, mais pour le moment, elles sont manuelles. Les données à se mettre à jour sur ce volet-là. Mais nous avons créé des cadres de concertation aujourd'hui avec le secteur de la santé animale dans la région pour pouvoir améliorer cet état des faits. Donc, je présente ici des formats d'utilisation. Ici, nous voyons par exemple comment un dashboard a été, à partir de l'entrepôt, a été mis en place dans le cadre pour pouvoir étager l'information. Un bulletin épidémique.
Is that it is empty in some areas.
La mise en place du scorecard et pour partager dans la région, par pays.
We can be able to share information in the region, especially country-specific information.
Le sanitaire de régulièrement différent. En résumé, pour faire court, je voudrais dire que l'un des points forts ici, c'est
one of the important points here
qui a été donné par les ministres les informations.
Is the mandate that was given by
et qui autorise les
and which authorizes member
personnel stratégique, c'est-à-dire que les personnes que nous formons et répétées. La qualité des données dans notre plateforme est au niveau du pays. Et nous nous demandons comment renforcer cela de façon continuelle, parce que en faisant face
further reinforce this continuously to get a better turnover.
Et des partenaires existent à CDC.
The speaker is breaking up. The interpreter can hear the speaker who's breaking up.
En matière de renforcement de la collaboration avec le secteur de la santé animale. Donc voilà un peu, mesdames et messieurs, l'expérience de l'Afrique de l'Ouest en matière de mise en place d'une plateforme de données Une seule santé que je voulais partager avec vous. Ce que je retiens avant de vous quitter, c'est qu'il faut un mandat politique fort, il faut des formations, des renforcement des capacités des acteurs pour pouvoir vraiment donner les résultats à temps. Il faut bâtir sur l'existant au niveau des pays. Parce que chaque pays a des petites plateformes qu'ils mettent en place. L'idée n'est pas de renouveler cette plateforme ou de les dupliquer, mais de construire sur elle pour permettre une interopérabilité et maintenant vraiment une approche inclusive et participative où tous les acteurs et les pays se retrouvent pour avoir plus de... Merci beaucoup de votre attention et je serai heureux de prendre les questions.
Thank you so much, Dr. Locoso, presenting on behalf of the ECOSO. I think we had experienced some few challenges in terms of the translations and also in terms of the audio. But nevertheless, the presentation was extremely useful, excellent, and also very, very informative. Dr. Locoso spoke about the health information policy that was developed by ECOSO, adopted, and also the data collections supporting the member states in how to come together in very coordinating manner. And I think it's consistent with the political wills and also the political power of all the regional economic communities that they can have competitive advantages to bring all the member states in the region that share like-minded health issues to have that platform for these discussions and also for the support. So if there are any questions, please put them in the chat because we still have 2 more presentations and we will come back to the questions later on. Next, allow me also to introduce our second speaker, Mr. Timothy Wasonga. Timothy is currently the pandemic preparedness and also One Health advisor at EAC Secretariat under the support to pandemic preparedness in East African community and projects implemented by GIZ. He is involved in preparing, enhancing the East Africa community region capacity to prepare and also to respond to disease outbreaks. He is also involved in mainstreamings and also in institutionalization of One Health approach in East African community. This consequently requires conducting simulation exercise, undertaking training to enhance capacity to respond to disease, among others. In addition, Mr. Wasonga is involved in One Health capacity building activity. The capacity building activity have entailed curriculum development, piloted curriculums, and undertaking training of One Health workforce in East African community. So from west to east, we would like to a privilege to introduce Mr. Wasonga for his presentations. Mr.
Recording
Wasonga,
stopped.
Mr. Wasonga, can you hear me?
Yes, I can hear you very well. Can you get me?
Over to you. Yes, we can hear you. We can see
Thank
you.
Yes, I am going to upload my presentation and move on. Are you seeing it?
Yes, We can see you, but put it on presentation mode.
Yes, that's what I was doing.
Thank you.
I don't know why. Oh, you can see it, but it is it needs presentation mode.
That's correct. Yes.
Okay.
Recording in progress.
Excellent. Is it there yet? Okay.
Yes, it is.
Thank you very much, Dr. Lul, for that introduction. As you've been told, and as you can see on the screen, my name is Timothy Songa, working currently as a pandemic preparedness and One Health advisor to the PANPREC project, as is known, support to pandemic preparedness in the East African community. And I'm going to share with you the EAC Regional One Health strategy initiative that we are having. In brief, I'm going to cover the introduction. I'll do a bit of an introduction rationale, what we call the council decisions of the East African community, especially focusing on the health ministers. I'll give you a brief on how we understand or how we have decided to think about One Health in terms of definition here. The situational analysis for One Health, just briefly, and then we'll go to vision, mission, the strategic approaches, then the priority areas and the strategic objectives, and finish up with the institutional arrangements within the East Africa in terms of implementing the strategy. I realize that we are time constrained, so I'll be a bit fast and I will go for the critical issues only. Ladies and gentlemen, I think it's common knowledge now, especially for East Africa, that we're experiencing a lot of, maybe last 10, 20 years, we've been experiencing a lot of infectious disease outbreaks. And just to name a few that I believe most of you already are aware about this: Ebola, Marburg, dengue, Crimean Congo, and all that, Rift Valley fever. I think we have a experience in East Africa. Of course, it is important to still mention that, as a way of introduction, that these outbreaks actually jeopardize public health, economic stability, and livelihoods of the citizens of East Africa. And as people involved in regional integration and totality in Africa, it's also important to note that we have a lot of trade. So migration and transboundary trade can also enhance this situation in case there's an outbreak. The issues of tourism and, like my friend was talking, Dr. Mulumba, between the interface, brings about the interface between humans and wildlife, or even the encroachment. The issue of migration of wildlife and livestock in the region could also contribute to this. And therefore, it was thought seriously that the East African community member states should sit down and properly prepare for this frequent disease outbreak, so that we enhance our capacity to be able to do this. Now, the whole idea is looking at the rationale for this strategy is that, and this has been referred to by one of the speakers from Panvar, that most of the threats that we have in public health here in East Africa are actually highly infectious pathogenic diseases, and around or over 60% of the pathogens actually that cause human diseases come from domestic and wildlife. Just to repeat, over 70% of emerging infectious diseases in humans have their sources in animals. These diseases, of course, do affect, like I mentioned before, animals and humans. And depending on their nature, they also have serious impact on other sectors. We in East Africa, for example, just thinking about COVID-19, have really been affected because the East African economies, if you look at it critically, depends seriously on tourism. We've been seriously affected. For those who come from East Africa, you will understand what I'm saying. At the same time, on focusing on this, as we thinking about this strategy, we are also thinking about other issues, other problems that we need the One Health approach, like the antimicrobial resistant AMR as it's known, and other events, also public health concern, not only diseases of floods, contaminated food, water, and all that. We need to look at them holistically. This, in our view, calls for the multi-sectoral and multidisciplinary One Health approach, which we, from experiences here, we have found to be crucial for effective preparedness in response to each of these threats. And therefore, as the East African community, it was realized that it is important that we should have a policy instrument that can guide the implementation of the One Health approach in the region, which was missing. Just to emphasize this point, the East African Sector Council of Ministers in charge of health directed that the issue of multi-sectoral collaboration and coordination be undertaken under One Health strategy, and also that it should be seriously promoted and strengthened. The issue of interdisciplinary collaboration should be strengthened. And in this regard, the EAC Regional Contingency Plan also embraces the One Health approach and provides for the same approach. In line with this is also the International Health Regulation, which I'll not go into the details because I'm sure each one of us here understands what the EHR is talking about. But the emphasis is on the issue of sectoral and multidisciplinary teams. So EAC considers the One Health approach as a key to increasing the overall resilience to threats and enabling preparedness and response to be all-inclusive and coordinated. Ladies and gentlemen, just to emphasize, this strategy is able to consolidating the gains so far made and streamlining and guiding the implementation of the One Health practice. At the same time, complement the national strategies while providing regional guidance, harmonize and consolidate and synergize the national efforts, and provide guidance and for multidisciplinary and, of course, multi-sectoral preparedness. Encourage and promote the development of community of practice in One Health, and also mainstream One Health overall in the EAC region. The only thing I wanted to share this slide is one thing about the issue of definition of One Health as we thought about it when developing this strategy, is that apart from what you already know and the definitions that are in place, the East African community decided to approach it and have a wider One Health definition in the issue of prevention and control of public responding to public health concerns. And in this case, we go beyond just human health, animal health, environment, and also involve the other disciplines which are affected by the infectious diseases or other event of public health concern that can contribute to the prevention and mitigation of the impact. And maybe that is the difference I would like to make, but it's important to us because we, from the experiences of East Africa, it has become important that we broaden the way we look, or we widen the way we look at One Health beyond those three areas. In terms of the situational analysis, and I'm sure quite a number of us know this, first of all, I want to say that the East African community, as I've already mentioned, organs that be, or the powers that be, have totally embraced the One Health approach. And of course, this has come a long way after quite a bit of discussions. And just to highlight a few, we have already got, like I mentioned, the contingency plan that embraces One Health. And also we have We have a risk and crisis communication strategy that embraces One Health, and of course, quite a number of SOPs that also make sure that they embrace One Health. That's at regional level. Just to highlight a few things about the countries that are members of East African Community. Of course, currently, as we stand, Burundi, the Republic of Burundi has so far no policy instrument, no One Health platform, but there's political will and they're starting off. The Republic of Kenya has one strategy for One Health strategy. They have a unit called ZDU already in place and actively involved in One Health activities established through an MOU. Rwanda, of course, have One Health policy, One Health strategy and a platform. South Sudan has no instruments so far, policy instruments, no One Health platform, but there is political will, and we are in advanced discussions with them. The Republic of Tanzania has a One Health office in place, in fact, fully constituted at the Prime Minister's office for better coordination. And I think this is the model of Tanzania is what we think would be the best way forward. They have all these strategies and instruments and the desks in the respective ministries on One Health. The Republic of Uganda has a One Health strategy also in place and units in the various ministries in place, and they also have one platform in place. And of course, the various countries, which I may not have mentioned here, the academia is also fully involved and research is going on in that area. Moving on very fast because of time, generally these strategies, vision is to embracing and widely ensuring that One Health approach is embraced and widely applied in the East African region, prevention detection to public health threats, and of course in creating an enabling environment for successful multi-stakeholder approaches towards infectious disease outbreaks and other public health threats. The guiding principles, basically this will look very much the same, but we have, of course, fully impressed the way the chair said, you can work singly and still achieve something, but when you are working as many, you achieve more. So we have a multi-sector involvement as a principle, multidisciplinary approach, science-driven, sustainability, and of course, capacity building, inclusiveness, transparency and cooperation, human well-being and prevention for, of course, better welfare. Ladies and gentlemen, in terms of the goals, it is to strengthen multi-sectoral and multidisciplinary preparedness for response. In terms of the objectives, is institutionalize the One Health approach at the EAC level, promote the application of the One Health approach in the preparedness for prevention, detection, and response to public health threats, and strengthen the One Health capacity in the East African community. In terms of the strategic approaches, the creation of an enabling political environment, and this we have worked on it seriously. There's a lot of political support, promotion of the One Health approach, and enhanced cooperation on One Health, and strengthening One Health approach, and of course, promoting of the One Health research. When we come to the strategic priority areas, we have grouped them basically into three: the issue of institutionalization of One Health approach, and then the issue of promotion, and then the capacity building. But under the issue of institutionalization of One Health, the key strategic objectives is to develop an EAC One Health policy and legal framework. We feel this is going to make us move and help in strengthening and anchoring One Health, not it just to be dependent on personal initiatives, but fully anchored in the policy instruments. The other thing is the issue of the need to establish an EAC One Health coordination office, and of course operationalizing it, and also the issue of mobilizing, making sure that we have funds for this EAC One Health office. Of course, for every objective, because of time, we have not gone there, but there are strategic interventions for each of those objectives, which we can easily break down, and that's what has been done. The next strategic priority area is to promote the One Health approach in the whole of the region. So the objectives are enable increased One Health stakeholder engagement in the EAC. So the issue of engaging one stakeholder engagement is critical to us, communicating the One Health approach to the stakeholders in the EAC, increasing One Health advocacy and awareness, and then using collaborative and multi-sectoral, multidisciplinary approach on One Health in preparedness and response to events of public health concern in the region. The other thing, under the issue of the promotion of One Health, one of our key objectives is to strengthen the collaboration of One Health in the region with the international community and the private sector too. We don't want to leave behind the private sector. And let me still emphasize that each one of those objectives has a number of key strategic intervention or activities that we are to undertake in order to achieve those objectives. Then lastly, among the priority strategic areas is the issue of strengthening the One Health capacity in the EAC region. And in this case, the issue of determining the existing One Health capacities and gaps in the EAC is one of the things we want to make sure that is done, and improve the framework conditions for One Health capacity building in the EAC region, and creating supportive environment for multi-sectoral and multidisciplinary cooperation, and then conducting One Health related research in the EAC and disseminating the results. Allow me to still repeat that under each one of those objectives, we have a flurry of a number of activities that are supposed to be undertaken in order to interventions that in order to achieve them. Yeah. So then what are the arrangements to be able to ensure that this instrument is implemented? The idea is to make sure that there's a well-coordinated approach by the various stakeholders, both regional and national level, and we have proper coordination and management structure to enhance the synergies. And therefore, we listed down all the possible key players within the region listed there. I don't have to go through them, but maybe we would better look at the structure that we are trying to make sure is implemented, put in place so that we can be able to achieve effectively. Take note that the secretariat, the ES secretariat, is the anchor of all these activities. Then we have One Health technical working group, and then of course all this in terms of partner states One Health focal points and the international organizations being members, and the One Health coordination on the extreme right, the One Health stakeholders from the local level to the national level to the regional level to the international level influencing, and then of course going up to the multi-sectoral councils and council of ministers for decision making. So this would entail the platform in which we are supposed to make sure that the East African Community One Health institutional arrangement, East African Community One Health strategy.
Mr. Timothy,
yes.
Can you wrap it up in 1 minute, please?
Not even 1 minute. This is the last slide. Thank you very much. This is the last slide because I wanted to highlight just the very important critical points and share with you the implementation framework. And this is important to make sure for us. This is what we think that will make us be able to move the agenda of One Health in East Africa. And Dr. Lul, with that, I am not going into issues of monitoring and evaluation and other side issues. And I take this opportunity to say thank you very much.
Well, thank you so much, Mr. Timothy Wasanga. Your presentation has indeed touched on so many important and critical areas that we truly need. And you emphasized with a lot of emphasis on the rationale on why the East African community truly need to have a policy guidance in terms of One Health, and how also East Africans is supporting all the member states and meeting them where they are, and also creating enabling environment to coordinate. I would also like to encourage you that we have Eastern Africa Regional Collaborating Center that's based in Nairobi. It will be really, really nice to work together to ensure that there's no any duplications, and all we do is in line with the need of our member states, and also reminded that working together is not an option. It will give us an ability to magnify all our little resources from finance and human, to put them together will give us big results. We can be able to accomplish so much. So thank you so much for those who...
Just maybe a minute. I just want to say that I didn't thank the rest of the people. Actually, we are working with all those international organizations, WHO, FAO, AUCDC, US CDC, and all other key relevant stakeholders in East Africa to make sure that this succeeds. The success only lies with making sure that we are inclusive. Thank you.
That is excellence, and continue just doing that, because together we'll be, we can accomplish so much and we can reach so many people. Thank you so much. For those who have a question to Mr. Timothy, please put them in the chat box. When we come back from our break, we can be able to answer some of those questions. At this point in time, we will move to our last presentation representing the regional economic communities, and it's my privilege to introduce the last speaker, Dr. Galusi Kabukwe. He worked as a field and laboratory and also as a vaccine testing veterinarian before he joined Baylor Institute in monitoring of HIV/ART treatment, particularly in relating to compliance and resistance. In 2015, Dr. Galusi has joined the SADC Secretariat responsible for the livestock developments. He has also been involved in developing of the SADC AMR strategy and monitoring in implementing that strategy. Dr. Galusi is currently working toward establishing a One Health approach at the SADC Secretariat. We in the Southern Africa Regional Collaborating Center, we have a privilege that we work very, very closely with the SADC Secretariat. We accomplished with SADC so many important activity, when we will continue working with SADC to ensure that all the 16 member states in Southern Africa, they are indeed implementing the One Health. We are also very privileged that all the 10 member states in Southern Africa region, all of those has dedicated the one technical officer and one health, and that's a huge progress. So with this, ladies and gentlemen, allow me to introduce Dr. Galusi Kabukwe to give us a presentation on behalf of the SADC. Dr. Over to you.
Thank you very much. But I think in one sentence, you have actually summarized the presentation I was going to make. I want to apologize for the fact that I won't be on video because I have mic issues. I have to speak from the top of the laptop. Basically, in the interest of time, I'll just go straight into the presentation. Is to share the SADC AMR activities with you, and hopefully there'll be a One Health component addressed as I share what is going on. I think we all know of the Flaming Fund project, which was launched in 2016, and it had a regional and national components as well as the global component. And at the national level, in the SADC region, Tanzania, Zambia, and Zimbabwe became part of the project. While at the regional level, it was not only until we had a meeting in Zanzibar in January 2018 that we really started to think at the regional level of a One Health approach. This meeting was organized by the FAO to review implementation of the global recommendation on AMR activities. And it was at this meeting that we realized that we needed a regional approach in the form of a strategy to address AMR issue. And the emphasis was doing this on a One Health approach. And this led to the birth of a functioning quadripartite in the sense that from that point on, the SADC Secretariat, as well as the FAO, OIE, WHO for the first time were involved in SADC activities at the regional level, together with other stakeholders like CDC and many other stakeholders that were involved in the process. Highlights so far that at the national level, 8 SADC member states have so far approved NAPs with political commitment as well. And 2 member states are at an advanced stage and are very close to getting their NAPs being approved to show with political commitment. And the remaining member states are working, when they have passed development stage, and working on political commitment and working towards getting approval in the near future. And at the regional level, we had a first regional AMR coordination meeting in July 2018 to review the status and way forward in relation to AMR activities. And these meetings were attended by directors from public health, from veterans, from environmental, wildlife were applicable, with all the other stakeholders that are important to the control of AMR. The second regional coordination meeting was held in December 2019, and it was to validate an AMR control framework, which the first meeting recommended should be developed. And this framework was developed with assistance from REACT, funded mainly by FAO and WHO. And I'm pleased to say that it was approved by our ministers at the SADC level in May 2021. So those are the main highlights so far. And here are pictures of the Zambia National Action Plan being approved by the ministers involved, signed by the CEOs of health, fisheries, and livestock as well. And it's normally a big event. We have similar pictures for the recent one being Eswatini as well. I just couldn't find them to show. Other initiatives in the region, we have held a regional workshop on AMR in aquaculture. And this was both training and a workshop also to find out what is going on. It was really informative, and it came up with a lot of activities and initiatives. In terms of awareness, a lot of people really appreciate it because people are not aware of the role of aquaculture in AMR. And we are also working on reviewing implementation of use of veterinary medicinal products in the region. And we are looking at member states' legislation, and this is with assistance from the tripartite as well. We are also analyzing development of a One Health approach to be used in the region to encompass everything. And we will be conducting review meetings on implementation of the AMR control framework. However, there's still some issues that needs to be addressed. Working together at regional and national level can still be improved, although we have structures and all that. This being a new concept, it always is a problem and can still be improved for various reasons. But we also we realize that different member states usually have different priorities and present needs over times. And things like One Health, sometimes they're forced on them by COVID, for instance. But sometimes they also take a step forward that they are not really the priority at the time. There's in relation to governance and multi-sectoral coordination, both at the national level, there's still certain problems like I mentioned before. But awareness and education can be scaled up and not left to specials one in a while event that happens. We need consistency in raising awareness and education messages. And surveillance and research is far from really taking off. And the next slide will hopefully highlight the challenges that are related to that. And investment for AMR still have to be taken up in most of the systems. Although we have NAPS approved, even as Secretariat, we have the strategy framework approved, but investment in making this still have to be taken up in the systems. These are some of the challenges that when the framework was being developed, came up through the study that was carried out before. And there's a lot of gaps that are identified that needs to be addressed. And if the presentation was longer than 10 minutes, I would have expanded more on those. In conclusion, at the regional level, at the SADC regional level, we have realized that with AMR, rabies, listeriosis, and COVID, like we had Dr. Mrumba was saying, and others, they have shown to us that the reality we are facing is to make One Health approach a reality, as opposed to just talking about. To realize this, we have to improve on coordination. We all, as stakeholders, have to be intentional in working with each other. We have to be dedicated in communicating to each other. And we have to be targeted with coordinating our activities instead of everyone doing their activities. With that, I would like to say thank you very much.
Thank you. Thank you so much, Dr. Galati, on behalf of the SADC Secretariat. I know you raised so many important things related to the AMR and also in how to connect them with the One Health strategy in the regions and perhaps in the continents. We come to the end of these sessions, I would like to thank all the three presenters for informative, enlightening, and also stimulating experience that you have presented on behalf of the regional economic communities from Westerns to Easterns and also to Southern Africa experience. We are very delighted, and for those of you who still have some questions to answer, to ask, please don't hesitate to put them in chat and we will get back to you. But because of the timing, maybe we'll ask all of you that at this point in time, we may take a very quick break for us to refill. And I ask all of you, please do come back. There's so much information that we would like to share, and we would like to come and connect all the work that we are doing, because it's bigger than one regional economic communities, it's bigger than one technical agencies. It's some things like Dr. Ahmed in the morning reminded us, is guided by African unions, the Agenda 2063, the Africa we want, and aspiration number 4, in specifically talk about the Africa we want, healthy and secure Africa. And also the aspiration number 7 is the diverse, is the African we want is driven by development of the people, especially the women, the youth, caring for the children. So at this point in time, with the permission of the chair of the organizing committee, I would like to ask you we can take a 10-minute break, but please do come back. And thank you so much, and God bless the rest of your afternoons. Over to you, Dr. Mohammed.